You asked me about a summary about the current advances in the therapy of acute lymphoblastic leukemia. And this is definitely an exciting era because for many years, actually, we didn't have any new drug or any new approach in acute lymphoblastic leukemia, especially in adult patients. And over the last 5 years or so, we've seen amazing advances, first with the introduction of the bispecific antibodies, blinatumomab, but also with the introduction of inotuzumab. And these two drugs have made a clear difference in the life of those patients who are struggling with a relapsed refractory ALL, and the randomized trials could show that you have a clear survival advantage compared to the usual standard of care we've been using over many years. More recently, I think another breakthrough came in with the introduction of the CD19 directed CAR T cells. And this is truly amazing because this is personalized therapy using autologous lymphocytes, and in heavily pretreated refractory patient, the single shot administration of CD19 directed CAR T cells proved to be highly effective, with more than between 50 and 80% complete remission and MRD negativity, which is a surrogate marker for long-term survival. And actually, a significant proportion of these patients are cured over the long term, and many of them are now enjoying long-term survival with very good quality of life. And during this meeting at EHA 2019, we do have a few very nice sessions regarding the role of CAR T cells in an ALL, but also in other diseases. And definitely we see the data being quite mature, further confirming the benefit. Of course, what is currently debated is about the outcome and how to salvage the patient who relapse after CAR T cells. Of course, we have the problem of loss of CD19, but also there are many other resistance mechanisms. So definitely CD19 positive CAR T cells in ALL are a true revolution, but we still have to do some work to overcome resistance. And of course, beside ALL, you would like to see things in AML. Of course, we do not have yet any routine CAR T cells in AML. I would say this is work in progress, but the good news, we've seen at least half a dozen of new drugs being approved in AML. So in general, after several decades of stagnation, the landscape of ALL and AML is really moving in the right direction, and this is definitely great news for our field, but also, and most importantly, for those patients struggling with these terrible diseases.